Welcome to Ulosca channel. Access all nursing practice questions. Care of the adult practice questions with answers.
Question 1. A nurse is caring for a client with COPD. Which finding requires immediate intervention? A. O2 saturation of 90%. B. Use of accessory muscles when breathing. C. Respiratory rate of 28. D. New onset of confusion. Which one is the correct answer? The correct answer is D. New onset of confusion. Explanation. Confusion in a patient with COPD may indicate developing hypoxia or hypercapnia, which can lead to respiratory failure. This neurological change is a red flag requiring immediate action. Question 2. What is the priority nursing action for a patient with chest pain and ST elevation on ECG? A. Place the patient in high Fowler's. B. Administer acetaminophen. C. Notify the provider immediately. D. Obtain a sputum culture. Which one is the correct answer? The correct answer is C. Notify the provider immediately. Explanation. ST elevation indicates a myocardial infarction. Rapid notification is critical so that reperfusion therapy can begin quickly and prevent further cardiac damage. Question 3. A client with diabetes reports dizziness and sweating. What is the nurse's initial action? A. Call the provider. B. Administer glucagon IM. C. Check the client's blood glucose. D. Offer high-protein snack. Which one is the correct answer? The correct answer is C. Check the client's blood glucose. Explanation. Symptoms such as dizziness and sweating are classic signs of hypoglycemia. Confirming the blood glucose level ensures the nurse provides the correct intervention based on actual data. Question 4. Which of the following is an expected finding in a patient with left-sided heart failure? A. Peripheral edema. B. Jugular vein distension. C. Crackles in the lungs. D. Weight gain. Which one is the correct answer? The correct answer is C. Crackles in the lungs. Explanation. Left-sided heart failure leads to fluid backup in the lungs, causing pulmonary congestion. Crackles are heard on auscultation due to alveoli filled with fluid. Question 5. A nurse is caring for a client post-abdominal surgery. Which action helps prevent atelectasis? A. Applying a warm compress. B. Encouraging deep breathing and incentive spirometry. C. Limiting fluid intake. D. Administering antibiotics. Which one is the correct answer? The correct answer is B. Encouraging deep breathing and incentive spirometry. Explanation. Incentive spirometry promotes deep breathing, which opens alveoli and prevents collapse in postoperative patients. It is a key intervention to maintain pulmonary hygiene. Question 6. A client with chronic kidney disease has elevated potassium. What is the most serious complication? A. Constipation. B. Hypertension. C. Cardiac arrhythmias. D. Fatigue. Which one is the correct answer? The correct answer is C. Cardiac arrhythmias. Explanation. Elevated potassium affects cardiac induction and can lead to dangerous arrhythmias, such as ventricular fibrillation or asystole, which are potentially fatal. Question 7. Which lab value indicates poor glucose control in a diabetic client? A. Hemoglobin A1C of 6.1%. B. Hemoglobin A1C of 9.2%. C. Random glucose of 110 milligrams DL. D. Fasting glucose of 95 milligrams DL. Which one is the correct answer? The correct answer is B. Hemoglobin A1C of 9.2%. Explanation. An A1C of 9.2% reflects chronic, poor glucose control over the past 2-3 months. Target A1C for most adults with diabetes is less than 7%. Question 8. A nurse is caring for a patient with a new colostomy. Which statement indicates a need for further teaching? A. I will clean the stoma with warm water. B. I should expect the stoma to be red and moist. C. I will call the doctor if I have gas. D. I need to empty the pouch when it's 1/3 full. Which one is the correct answer? The correct answer is C. I will call the doctor if I have gas. Explanation. Passing gas is expected and normal with a colostomy. Calling the doctor for this indicates misunderstanding and a need for additional patient education. Question 9. What is the best intervention for a patient at risk for pressure injuries? A. Massage over bony prominences. B. Use donut cushions. C. Reposition every 2 hours. D. Keep linens tightly tucked. Which one is the correct answer? The correct answer is C. Reposition every 2 hours. Explanation. Repositioning every 2 hours helps prevent prolonged pressure on one area, improving circulation and reducing the risk of skin breakdown, which is essential for preventing pressure ulcers. Question 10. A nurse is monitoring a client receiving for morphine. Which finding is most concerning? A. Respiratory rate of 8 breaths min. B. Pupillary constriction. C. Itching at the fourth site. D. Reports of constipation. Which one is the correct answer? The correct answer is A. Respiratory rate of 8 breaths min. Explanation. A respiratory rate below 10 indicates respiratory depression, which is a life-threatening complication of opioid use. This requires immediate action to prevent respiratory arrest.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.